welcome to Wave Support. I see from your case you have a patient who has quite a bit of corneal ectasia following refractive surgery in this left eye. And I understand from your case request that their prior contact lens, this design that I'm pulling up right here, has been relatively successful except for some inferior touch down here. I guess my first thought is if the lens is physiologically not putting the cornea at risk, in other words, if it's not doing any damage, you may not want to make any changes on it. But I'm assuming from your clinical impression that you would like to make a few changes. So let's talk about that for a minute. Your first inclination of going a little bit larger on the lens I think was a good idea. The idea is to get it larger so you can vault over this cornea to avoid this area. Just a couple comments on this topography. As you know, we have a pretty steep area with the K readings here. And so anything that you come over the top of this lens in a spherical design, you're going to probably get a little touch down here near the bottom of the lens. And of course, we don't have a whole lot of data down here, so we don't know how far this extends down toward the bottom portion. So any of these scleral designs, you have to get them pretty steep to get over this area without any significant touch. And my guess is no matter what you do, you'll probably have some touch down in the area down here near the bottom. With that said, then it's just a matter of clinical judgment whether you feel that the patient physiologically can stand that little bit of touch down there. If that doesn't work, another alternative is to go back to more of a semi-scleral design in a wave freeform design, trying to use a little bit more of the data from the cornea, using a freeform design to try to get over this area to minimize the touch on there. And I kind of mocked up an example here based on the 8-step approach that Dr. Maller came up with, and I'll attach a video to this email that links you to that video of the design for Dr. Maller. There was a good example on there of a case that was very similar to this that was a successful fit with a semi-scleral freeform design. But the idea here is to try to more closely match this area of elevation, but still resting this lens a little bit on the edge of the sclera. So with that said, I think either design could be an option for you. And once again, if your lens is sitting reasonably well and the patient's not having too many symptoms with it, you may just be better off staying with what you've been working with. I guess one other thought that comes to mind, you could consider taking your original design and switching more to a GSIM design to see if you can get a little more freedom to make changes in this vertical meridian. And that might give you a little bit better chance of lifting that lower part of the cornea or the lens off the cornea. Well, with that, I wish you well with this difficult case, and thank you for contacting Wave Support. Have a great day.